Hey everyone, welcome to the March episode of Health Equity Mondays. You are joined by Jasmine and Omari, and today we are talking about Death of Despair, the Trevor Project, and how it's supporting LGBTQ plus youth, plant health equity, and of course our quiz for the month.
Which I'm going to ace this time.
I don't know. You're either going to be like, oh, of course, or you're going to be confused by it. So
I guess we will see. Wait around till the end of the episode to find out if I get it right.
Hey, welcome to Health Equity Mondays, hosted by Jasmine Leonard
and Omari Richins. Here we'll talk about all things health equity, public health, and culture.
Let's do our part to move health equity forward and all that jazz. Yes. Okay. So, birthday boy, how are you doing?
I'm doing well. You know, birthday was nice and relaxing. Got a little surprise from my partner. Was able to just reflect and did a little cold plunge, a little hike, a little drinking. At least the night before. Definitely. I don't know. Feels good to be 29. If you all do want to support and celebrate my birthday, you know, there's a link below where you can buy me a coffee or contribute as a one-time contributor or become a monthly contributor, and I greatly appreciate that because this is sweat, tears, blood, and everything for the Public Health Millennial and this Health Equity Mondays. So greatly appreciate you all. Happy to be here. Happy to celebrate another year of life, and grateful for everything that comes with it. So give thanks. How are you doing, Jasmine?
Well, you know, I also had a birthday at the first of the month. I like to, you know, welcome all of my March babies into the month. So I am filled with a lot of gratitude. I had a really great birthday. This has been a good month. Lots of people showing up for me in ways that I don't typically allow them to. So it's nice to be growing and evolving in that. And yeah, it's been, you know, weather-wise, March has been showing its entire ass, but it's nice to have more sun. I'll say that.
I will agree with that. Like, my birthday was perfect weather. It was awesome to be able to get out and hike and just be out in nature with some beautiful weather and some fresh air and some cold water. But, you know, so it goes.
Yeah, okay. We're going to have to talk about cold plunges one day. I'm sure there's some health equity in that, too.
Probably. I don't know. I don't see too many Black people on Instagram hopping on the trends. Maybe I gotta become that person for Black people so that more Black people are able to do it. But granted, I do think there are Black people out there doing it and getting the benefits from it. You know, shout out to all of you. People of color, melanated people out there that would be doing their thing, jumping in the cool water when people think you're crazy.
I mean, yeah, you are a little bit, but it's cool.
It is cool. Okay. Hey everyone, just jumping into the health equity topics today. We're going to be talking about the Death of Despair and then the Trevor Project. If you or someone you know may be considering suicide, contact the crisis text line by texting HOME to 741-741. That is HOME to 741-741. Content warning, we are going to be talking a little bit about suicide, so just so you all are aware. So we're going to be talking a little bit about the Death of Despair, and just for anyone that doesn't know what that was, I didn't know what it was before reading this article, is mortalities stemming from drug overdoses, suicides, and alcohol liver disease. This is thought to be unique to the white community, but the data says differently. Dun, dun, dun. Okay, so as you all can see here, there is an article by NPR, Native Americans Left Out of Deaths of Despair Research. I'm going to go down a little bit here. You'll see that researchers attribute much of the rise in midlife deaths to what are called deaths of despair, which is, I just explained, suicides, drug overdoses, and deaths of alcoholic liver diseases among middle-aged white Americans. In the Death of Despair, the idea that the rise in death of despair was the highest in the middle-aged white Americans was put forward by two Princeton economists in a study published in 2015. They looked at the death rates for people aged 45 to 54 years old from 1999 to 2013 and compared the numbers by race and ethnicity. And the author of the article that is posted by the Lancet, I can't remember his first name, Friedman, he said, ideally, no one should die in that age group, certainly not of overdose, suicide, and alcoholic liver disease. And what is really interesting is that though the Princeton economists and a lot of the data that is studied around the deaths of despair is focused on white Americans. As you can see here, the deaths among white Americans did go up by 9%. However, the deaths among Native Americans went up by 30%. So we can see that's a 3-time increase in the amount of deaths from Native Americans versus white Americans.
Is there any information as to why they think this is just a white phenomenon? Or is it just that these two Princeton economists said we're only focused on white people?
I'm not too sure. From this article, it seems like the othering of Native Americans, or like putting them in the box of other, was how they were used in the data sets. So the data sets didn't pull race of specific Native Americans. So it might be just the data sets that these economists were using didn't have or didn't present the data in a way. And I think this is like part of the argument and the conversation that I want to have here, is that yes, that might make sense at first glance. Like the white Americans in this age group should or are suffering more from these diseases. And I just want to say that like this is an issue regardless of if you're white, Native American, or black. Like this is an issue we want to deal with. And I think the deeper issue here is like where is the data? What is the data we're looking at, and how can we like collect better data to move forward? So just going a little bit deeper into exactly what Jasmine is saying is that what's sad about this is that the data sets that they use to study really caused the erasure of indigenous people from this narrative, in which is damaging in the face of health equity. And I think this is really important when we think about health equity and data, and how important it is to collect data, especially about specific races, to understand what are the issues and what are the challenges of the specific community, and not trying to put everyone into one bucket and say that this is just a broad issue, but understanding where are the health disparities, and thus more likely than not health inequities in this data. The article also highlights that indigenous voices get left out of a lot of public health data sets as they are lumped into the other category. And as I just stated, this is a way of erasure or devaluing a community and erasing their data, or hiding it, or not being specific about the specific race, is why data is so important in what we talk about in health equity. Because if we don't know what the standard are, the measures are, the barriers are for a certain group, then we're never going to know when we reach health equity. So that's why it's really important to collect data, and diverse data that really tells you, and you can like narrow down on what populations need the most amount of supports around which issues. While deaths of despair is not good for white people or indigenous populations, we must understand like the magnitude of the issue. And when race is behind that, we must understand what the magnitude is for a certain race, so that we can create the types of programs, policies, and give resources that can be aimed at providing the solutions for the groups that are most affected. And in this, we need to focus on more than just death of despair, because as we know, health and well-being do not happen in a silo, and there are structural, economic, resource allocation issues, and all of these things affect populations. And when we think of it, and considering, if we were to just look at this without considering the indigenous populations, we might think like this is a white issue. And in that, we would see that resources and programs are aimed at the white populations, but then it forgets to target the Native American populations and other populations that are affected worse. And therefore, that just leads to more health inequities and less resources in the hands of the people that need it the most. So the article goes on to highlight that the indigenous U.S. populations have the highest rates of vaccination in the U.S. as of January 2023, which is something I did not know and I was not aware of. So the American Native, Alaskan Native populations have a 78% rate of receiving at least one dose of the COVID-19 vaccine, which is really cool. And I think it just shows the importance of how the communities there were trying to ensure that their elders and their people were kept safe during this time of a lot of things we didn't understand. So, and I think this goes into the bigger point of why we need local solutions and community-based solutions to address these health issues, as well as like the policy and advocacy to advocate for those structural changes and those policy changes to have health as a as a better reality for all people. In closing here, I just want to encapsulate that we must collect data. Don't let anyone tell you that race isn't important. We need to collect all the data, the race data, the ethnicity data, to ensure that we are addressing the issues for the people that need the resources the most. If we erase data and we don't collect data for certain populations, then we just continue to exacerbate this disinvestment and lack of resources in these communities, which leads to greater health inequities. So moving on to the next topic for today, the Trevor Project. And if you all remember from last month, Jasmine said that we need to talk about something a little more positive. So I tried and I dug around and I found this. And I think this is the most positive that I could find around health equity. If there's something more positive that you know about, please feel free to share with me on Instagram at the Millennial, or you can email me, thephmillennial@gmail.com. I would love to know what is going on positively in the health equity world so that I can share it more broadly with everyone that listens to this. So thank you. So on this good note of health equity, recently, I think it was last year, $30 million was put into the fiscal year 2023 omnibus appropriations for the Substance Abuse and Mental Health Services Administration, or SAMHSA, to enhance training and provide access to marginalized youth. I have to dig a little bit deeper into this to understand who these marginalized youth are, who they're considering marginalized youth. But I think just highlighting this Trevor Project is important because it is something that has not been done before. And I think it's hugely, hugely important, especially as you hear the statistics and the data that I'm about to share. So we know that culturally competent care is really important, especially in moments of crises and especially in populations that are isolated and that are marginalized. So on trying to improve access for people in marginalized communities, in September of last year, 988, which is a crisis hotline, launched a pilot program called the Trevor Project, which will be used to connect people with counselors specifically trained to address issues faced by LGBTQ plus youth, which is awesome. And I think this is something that we need more of. And I'm not too sure if the funding, the $30 million, was only going towards the Trevor Project, or if they're also going to consider other prevention methods and ways to get support to these communities, which I think is also important. So just to give you a little overview of what this issue is that there's an estimate that 1.8 million LGBTQ plus youth, so that's people aged 13 to 24, seriously consider suicide each year in the US. So just to give you a general idea of this issue, there's estimated that 1.8 million LGBTQ plus youth, that's youth ages 13 to 24 years old, seriously consider suicide each year in the US, and at least one attempt suicide every 45 seconds. So while you're listening to this, just really think about how people are being affected and what we can do to really address these issues and really not only solve people in crises, but how do we get to the root causes of these issues to ensure that LGBTQ plus youth are safe and are living their healthiest lives out there. So just continuing more into the statistics, LGBTQ plus youth are 3 times as likely to attempt suicide than other youth. And breaking this down into other groups of LGBTQ plus youth, trans teens are 5.87 times more likely to attempt suicide than all other teens. Gay and lesbian youth were 3.71 times as likely to attempt suicide, and bisexual youth were 3.69 times more likely to attempt suicide. 45% of LGBTQ plus youth seriously considered attempting suicide in the past year, and nearly 1 in 5 transgender or non-binary youth attempted suicide in the last year. 60% of LGBTQ plus youth who wanted mental health care in the past year were not able to get it. And just on a side note here, the state of Washington in last year's November launched the Native and Strong Lifeline, the first suicide crisis line for American Indian and Alaskan Natives. So not only is there this new hotline to address LGBTQ plus youth in crisis and really ensuring that they are getting the culturally competent care, but similar programs are opening up specifically in Washington state to support Native American in these crises. As we know, they also suffer disproportionate rates of suicide and attempts at suicide. So I just want to say, like, this is a great start. This is a positive for health equity. And I hope this funding goes towards not only this hotline, but preventative methods, as well as increasing access to mental health, not only in times of crisis, but in regular times, and just giving youth and LGBTQ plus youth specifically access to culturally competent care so that they are able to feel comfortable in themselves, and be able to live the healthiest lives.
This was our best attempt at good news. No, I'm joking. But I will say that it's actually very timely that you brought this up, because in my last newsletter, Becoming Dr. Health Equity Jazz, I actually spoke about suicide from the Black youth perspective, because that's what I was studying almost all of term 3 in school. So if you are listening to this and you want to know more about the crisis in the Black youth population, you can find that in my last newsletter. And also, I just want to say personally that suicide prevention is very near and dear to my heart. I have been a person who has contemplated and attempted suicide. So if you are struggling and you are looking for help, the crisis line is absolutely amazing. I actually used to volunteer as a hotline listener. So I know the training that goes into that, and I know just the willingness to really be there for people, and people that volunteer for that. And also, there is an upcoming Out of Darkness overnight walk in DC. So the American Foundation for Suicide Prevention does an annual walk that is an overnight walk. It's about 16 to 18 miles. And it's a fundraiser for suicide prevention and to increase the dialogue around this. So if you follow me, you'll see me talk a lot more about this in the next coming months as I am preparing for the overnight walk.
Awesome. Well, thank you for sharing that. And as you all may have forgotten, all the links that we are reading from, we get information from, will be shared below so that you can read more about these topics and dive a little bit deeper. And like, we'd love to continue this conversation. So if you ever do want to continue the conversation, feel free to reach out to any of us on Instagram, on LinkedIn, in our email inbox. We greatly, greatly appreciate that. Before we move on to health equity in the culture, just wanted to give a little promo break. So as I said earlier, I didn't have an Amazon list like Jasmine did, but if you would like to support me and the Public Health Millennial as a platform, feel free to jump in the link in the bio to the Ko-fi and either be a one-time supporter or a monthly supporter. I know I have 2 monthly supporters right now, so shout out to you all. Love you all. So thank you all for that. And I did forget to say, thank you for being vulnerable about that, Jasmine. We love you. And to anyone out there that might be contemplating suicide, like, we love you as well. And if you need someone to talk to, just feel free to reach out to us. And if we are not the right people for you to talk to, we will try to connect you to people that are able to assist you.
Oh, sorry. One big thing. And I will mention this unfortunately, right now, this is for people that have insurance. But there is an amazing website called headway.co. They will link you to therapists. You can really filter in and get in all of the parameters that you want, right? Like, I want a Black woman who is comfortable talking about suicide, comfortable talking about motherhood, and all the things. You can really go in and filter out to find the best person for you. They have a lot of availability across the country. They are planning to within this first half of the year, I believe, they want to be open in all of the states. So check them out. If they don't have availability in your area yet, like, it's coming. And I work with them, so they are really great. And I would not steer you to the wrong people. So check them out. Right now, you have to have insurance. So that is a limitation, but we'll include a lot of other links for free resources as well.
Yeah, just check it out below.
As I said, you should be subscribed to my newsletter, Becoming Dr. Health Equity Jazz. That's the free version. But I actually have a paid subscription as well. 3 people are paying to learn a little bit more about me. This goes into the Jasmine behind Health Equity Jazz. So if you're interested and want to support, you can find me there. And as always, if you want to connect with me, you can find me on IG, a little bit on TikTok, and always email me. So
same
right.
Same handle on TikTok.
Yes. The only place it's different is Twitter because of.
That's neither here nor there.
I mean, but right, who's even on Twitter anymore? Right. But I guess, people whatever. Okay. I know everyone. All right. So health equity in the culture. Omari, are you a plant father?
Kind of. I do have these beautiful flowers that I got here. That anyone that's looking at it, some eucalyptus. And if anybody knows what this other flower is, please let me know. It's purple and it's green, as you can see on the stem, and then purple in the flower. It's beautiful. Check it out on YouTube if you're not looking at this and only listening.
Okay. Well, I'm a plant mom. If you follow me on IG, you know that I spend a lot of time talking about my plants and how I'm trying to keep them alive. You can also see, if you're on the YouTube, you can see some of them. So the ones that are right there, those are Hippolyta. There are 3 of them. So if you are a Lovecraft Country fan, you'll understand why there are 3.
I love Lovecraft Country. I don't know why they didn't do a second season, but that's neither here nor there. And that's a whole other conversation about health equity in theater and cinema and movies and stuff.
Yes, and also like the Afrofuturism sci-fi aspect of health equity. Like that's definitely a topic.
Let us know if you've watched Lovecraft Country in the comments below.
Please, and if you haven't, it's on HBO. So go watch it now. Well, not now. Listen to the rest of our podcast and then go watch it. So recently there was a Times article written about plants. So I'm going to just break down some data for you all, and then I'll go into the actual health equity aspect of this, because you're probably like, why are we talking about plants and health equity? I told y'all I could find health equity in everything.
That's me right now. Why are we talking about plants and health equity? Illuminate me, Jasmine. Enlighten me.
I got you. So I'm going to share this article, but, we always have all the information for you. All right. So in March, the greatest month of them all, Times did this article. Your houseplants have some powerful health benefits. Okay. Did you know this? I kind of did, but I'm going to educate you all. So the interesting piece here is that there has been a surge in plants and gardening related purchases. Okay. Americans have spent $8.5 billion more on gardening related items in 2020 than in 2019.
I'm a part of that statistic. I definitely bought a lot of gardening stuff in that time.
I also, all of these plants are pandemic babies. Okay. So I know and they even mentioned Plant Talk on TikTok. There's a lot. Okay. But let's talk about the health benefits. So one of the health benefits are that they may reduce anxiety and stress. So what I've highlighted here is that from a study, they found that indoor plants can reduce physiological and psychological stress. We see a clear connection with the fact that being around plants improves cortisol levels in our body. We hold our stress hormone cortisol in our saliva, and we know that it is decreased when we're around plants. So less stress, less anxiety, but that's not it. Plants also can help sharpen your attention. There's been research that suggests visible greenery is restorative and increases the ability to concentrate, including among kids. So I know there are parents listening to us. Your kids can benefit from your household plants. They can also help patients heal faster. It says plants may play a role in speeding up recovery from an illness, an injury, or surgery. So, have I really told y'all all the reasons yet?
Maybe.
One more.
Okay.
One more. Not yet. Okay, so plants also can increase happiness and life satisfaction. So, this is a great one. It says in one experiment, people who spent 5 to 10 minutes in a room with a few house plants felt happier than those in a plant-free room. Spending time around plants is also linked with increased self-esteem and greater life satisfaction. And a couple more reasons to have plants. They can make you more productive. A study found that office workers were 15% more productive after plants were introduced into their workspace. And then lastly, people who had household plants or a garden experienced fewer symptoms of depression and anxiety than those who did not.
That's awesome.
Right? So there are lots of reasons and lots of health impacts of having plants. So I know, where's the equity issue in this?
Tell us. We want to know.
First of all, did y'all know that there's a consumer report that looks at like purchasing of plants?
Just plants? I know there's a consumer report.
Just plants. Just plants.
This is why we need funding for everything to study plants.
Just plants. I had no idea about this, but essentially there's this like consumer houseplant purchasing report that comes out, and it's done by Texas A&M University, and they essentially look at data on who's most likely to purchase plants. And they were interested in pre-pandemic to post-pandemic information, right? Because I just said that we're spending billions of dollars more on gardening and plants, and does the data actually support this? Well, it does. So I'm going to share a couple of demographics, but before I share the graphs, we're going to go into the details of the study, and we can talk about whether we think that this is a true reflection of America or not, but they tried their best, seemingly. So they did an online survey. So online. So we're already a little bit problematic in that, but they did an online survey, and essentially they screened people in order to not oversample or undersample. And in order to even get through to the first part of the survey, you have to respond to 5 home decor items that you would purchase in the next year. So if you choose at least one object that's a plant or a plant-like product, then you can continue. Okay. Then you're shown a picture of a house plant and asked what your level of interest is around that house plant. And then you're asked if you would purchase this for yourself or someone else, and how many house plants you have and how often you purchase house plants. So in order to get into the study, only people who showed a neutral or greater interest in plants had at least one house plant and indicated that they purchase house plants at least once a year. Those are the people that were allowed to continue. Okay. So we got about 1,700 people that fit into that category, and they're called purchasers. And then in order to, give some other data for the control, they allowed 300 people to continue, and those became non-purchasers. Okay. So I'm going to focus on the purchasers because I'm trying to figure out if there's some equity issues in household plants. And lo and behold, the data says yes. Okay, so let's look at the data. I'm still fascinated that this is an actual report, but they actually do a pretty good job on giving us demographic information of the people who are considered purchasers. So in this graph that I'm sharing, you can see the average age of the purchasers. And so they tell us in this nice box, which honestly, this is one of the first times I've seen just like a nice breakout of what I should care about in this graph. So I would say kudos for this part. But essentially they tell us that the mean age of purchasers are 51.8 years old. 6% are Gen Z, 34% Millennial, 11% Gen X, 45% Baby Boomers, and 6% the Greatest Generation. I did not know that there were all these names for these generations.
I never heard about Greatest Generation before, but we'll take it. We'll take their word for it.
whatever they want to be called, that's fine because they old. I mean, that's like,
right.
I don't even know that's yeah. Is that the 75 to 84?
It's
I don't
got to
know.
be.
Yeah. So, all right. So basically, those are the age groups. Then they let us know the gender of purchasers. So I don't think this is a surprise, but 60% of purchasers are female.
A little
And
surprising
actually,
to me. I thought it'd be more females.
oh, really? You thought it would be like 80% or
That's
something?
75.
75? Okay. Okay. Well, more women are buying plants. And then I'm going to skip some demographics, but if you are, of course, interested, you can check out the link. And here I'm coming to the ethnicity of purchasers. Actually, this should probably be race, but you know, that's neither here nor there. 85% of purchasers are white. 4% are Black or African American. 5% are Asian or Hispanic, Latino, and then less than 1% are Native American, Pacific Islander, or other. And only 0.4% actually declined, which that's surprising to me. But yeah, 85% of purchasers are white. This shocked me. And it might be because of how curated my timeline is. I see so many Black people buying plants and being plant parents. But yeah, 85%.
Yeah, I find it interesting that only 4% is African American. I would think it would be at least like match the population demographics, like 13% around there or so, but it's not the case.
No, and you know, thank you, Omari, for bringing in the perspective, right? When we talk about disparity or inequity, that would mean that there's something happening that is making this number lower. I'm going to talk about some reasons that I think are causing the inequity in plant purchasing, but I just wanted to give you all the data so that you understood where I'm going. There's some other data in here that shows like the percent change between 2019 and 2021. So pre-pandemic, post-pandemic, but we'll leave the link so you all can look for yourselves.
Yeah, it's a wonderful 291-page document. Enjoy.
I mean, they break down the big points, but it's a lot of data. They ask a lot of questions. Again, right. I never would have thought that this was a real thing.
Right. And I find that interesting that people are answering this. I hope people are giving the same amount of attention to their census and other, probably a little bit more important surveys. But hey, we're here nonetheless. You know, people are studying plants, and it's important for our health, as Jasmine shared earlier. So I will listen.
Okay, so I gave you all these amazing reasons for having plants and the benefits of household plants. And if you have been listening to us or even following some of the things that we've been sharing lately, right? Like, we know that Black people are under a lot of stress, are really worthy of wellness. And for there to only be 4% of the population, 4% of purchasers to be Black, that's an inequity. If plants have all of these health promoting factors, right? Like, there should be a plant in everybody's house. I mean, in all honesty. So why are these disparities happening? What's causing the inequity? So I'm just surmising on this part. Okay. I am not a botanist or a sociologist that's, you know, really focused on understanding plant ownership, but I'll speak from my perspective and just some thoughts that I have. Number one is income. I don't know about y'all, but my plants are expensive. I literally just bought a humidifier for my plants. Okay. So granted, you don't have to be as bougie as I am, but like, these plants aren't cheap. Even when you go and buy them from like the non-nursery type places, like, they're not cheap. Their pots aren't cheap. The soil isn't cheap. I mean, they need bougie water too. Like, if you're really trying to keep them alive, because I've been reading a lot of stuff and it says that tap water isn't that good right. for them. Like, what? So now I'm buying purified water. They have a humidifier. Like, they have things. They're like children. Right. Okay. Granted, they're not as expensive as real children, but like, I care.
Okay. Right.
Okay. So if you have a lower income, I could imagine that buying plants and trying to keep them alive and, you know, doing all the things that you need to do in order to make them happy, it's a deterrent, okay? The other thing is housing. So actually people who that own their own homes or that have outdoor spaces are more likely to have plants. So when you think about this, that would mean that we all know that home ownership is mostly a white game. And therefore, we're already kind of saying that you don't have your own space, you don't have enough windows, you don't have this, you're not going to have plants. And honestly, if we think about all the health promoting factors of plants, it should be the inverse on it, because I think people living in apartments, townhouses, co-ops, and all of that, like, y'all need the plants more because you need to be able to filtrate some of this air to potentially reduce some of the asthma in the areas, to counterbalance the fact that there's probably not enough green space around you at all anyway. So that's another reason. Geography, the availability of just even being able to get plants, right? Like, I don't know about like where you live, but a lot of the nurseries where I live are closed. They did not make it through the pandemic, even after the craze, but they were already starting to leave prior. So again, if you're not wanting to just go to like a Lowe's or, you know, even Walmart and the places that have plants, and you want to go to get like the nice, you know, philodendron princess, you have to go to the fancy places, and they're not everywhere. Education also could be a reason because, as I said, I've been doing a lot of like reading about plant culture now and trying to do the best that I can for my plants. And that requires a lot of time and energy and like knowing what to do and knowing where to go. And so if you don't have that kind of ability to navigate the system in the same way, or even to have the literacy to be able to read the information, because none of this information is at a fourth grade level. I'm gonna just be honest. So I think that that's a big issue as well. And then access to information tying in with education, right? Like, I can kind of figure out and go where I need to. And I even have people in my life that have plants, right? But if you don't have other people that are around you that have plants, and you're kind of the first person trying this in your area or in your group, like, it's a lot and it's scary. And nothing's worse than a plant coming into your house and then dying, because it makes you feel like a failure at something. So
I think there are many things worse than that, but okay.
You know what? That's fine.
That's real.
I mean, yes, there are a lot of things that are worse than that. But what I'm saying is that when you as a new plant parent are super excited and you're like, oh my gosh, I have this cute little plant and it's going to like bring all this joy to my life. And then 2 days later it dies. You're kind of like, well, damn, is there something wrong with me? Did I do it? Like, am I the problem?
Right. Feeling of defeat.
Yes. So the opposite of what we want to have happen.
Right. But this is really cool, because I feel like it just shows like a simple solution or a simple factor that people can have in their lives that helps improve their life. And it doesn't take too much. Granted, like depending on what kind of plant you buy, and then the kind of upkeep you need with that. Like for myself, I probably prefer like a cacti or something like that, which I don't know if it has the same amount of filtration as those other plants, but you know, just less effort.
Yes. I mean, there are benefits for all plants, and I feel like one random thing that I wanted to bring up in this is that I'm becoming more and more invested in our words and language and things that we use. And so I was trying to figure out where the idea of black thumb came from, when that seems so counterintuitive to me, right? Like that you're saying a person with a black thumb can't keep a plant alive, when we all know that in this country, Black folk was keeping everything alive. So I did look this up. Merriam-Webster says that the idea of black thumb didn't come into like the nomenclature until 1954. I don't know what happened then that made this kind of be the antithesis to a green thumb, beyond the fact that in this country we seem to, tie all negative to
Right.
Black. But yeah, I think we should reclaim Black Thumb, because yeah, we are the originators of keeping crops, plants, gardening alive.
Yeah, and I think to that point, like in my personal, well, in my work, I work with a lot of Black farmers, and I think to that point is that, like, we have a lot of difficulties in getting the younger generations wanting to do this kind of work, and yes, that comes with a lot of like the trauma of the USDA and the other oppressive systems on farmers taking their land, etc., etc. But like to your point, just having a plant or planting, whether that's outside and getting your hand in the dirt, has so many positive benefits. And I know a lot of groups use planting and gardening as a way of like supporting more resilient children and reducing the amount of ACEs and giving them a way to like utilize their hands and think in building and growing something and seeing it grow something that they have never done before, which I think is very impactful. And I think to your point, like Black Thumb has been categorized on us as a population, probably to try to get us out of this agricultural space even more so. And I wonder how that fits into like all of the policies that came in with the USDA that kind of shut farmers, Black farmers, out of the farming markets and creating a lot of trauma in those circumstances. So yeah, very interesting. I think like there's a lot of space to do agriculture work and use agriculture work to be health promoting in a lot of ways, whether that is an indoor plant or gardening outdoors. So I'm glad that you brought this up because this was interesting, and I'm sure that people can dig a little bit more into this and find some more information. And just once again, it's interesting that there's an entire consumer report on plant buying. Hopefully, we can get that kind of support for public health and continue to get people to take surveys and get investments to improve lives. So let's get some investments into getting plants into lower income communities, or gardening into lower income communities, because I think that serves a two-pronged purpose in helping people to grow their own food, as well as getting them more connected to the land and like creating more resilient people.
Yes, and also I think that there's a tie-in, and I honestly I was kind of joking this past week when I said on IG that employers should be buying their employees plants if they like want us to be happy, just like, and not just doing these dumb wellness programs. But the data now actually says that yes, employers should be buying employees plants, or like give me a gift card so that I can buy a plant, because guess what? Most of us are working at home, and the data says that we'd be more productive if we had plants. So
right. Can't deny the data improves productivity and has improvements to health as well. So plus employers, put it into your plans.
I would like a philodendron princess or a white knight, because if y'all gonna buy it, it's gonna be expensive. So just to let y'all know.
Right. I'll take a cacti.
Okay, so it is game time.
Okay.
All right, y'all. It's time for Equity in Action, our quiz that Omari hasn't won yet. So I don't know. It's my turn to ask. So we'll see if this is the win for him. You know, he just had a birthday, so I maybe the birthday, you know, joy or something will help him get this one this week.
You guys
ready?
See all the shade she's throwing at me? All right, let's continue.
You ready?
I've been ready.
Oh, okay. My bad. All right. So this is going to be a true or false. True or false? Current shark migration patterns are directly impacted by the transatlantic slave trade.
True.
False.
This is not even an equity question, people. This is not even an equity question.
The keyword here is current. At one point, shark migration patterns were impacted by the transatlantic slave trade.
So if we extrapolate this data out into currently, we'll see that the trends still exist, that the inequities of the shark migration patterns have changed as a result of the transatlantic slave trade. So I think someone's got to fact check this one.
Okay, and that's fine. If someone finds the current data on this, then I would absolutely be willing to say that that's correct. And I wanted to bring this up because I saw this going around on IG, and I think it's important to always fact check things that are going around on IG. So recently I saw someone post about shark migration patterns and saying that, oh my gosh, I'm shocked because I just learned that they were impacted by the transatlantic slave trade. And yes, at one point they absolutely were. And it's actually, I will provide the link to the article that I think kind of it would have broken the internet at that point in time. Essentially, this guy wrote like a 20-page essay on how he went through all of the historical information and found all of the accounts of the enslavers and even I guess, those that were allowing Black people to be purchased, all of their accounts of how sharks weren't in the water previously, and then all of a sudden they were there, and they would follow the ships up to a certain point, and then they would go back to the shore, knowing that another ship at some point would come. And so the diversity of tiger sharks has actually increased as a result of slavery because they had a constant source of food for those years in which people were being shipped and transported. So I think that you always want to fact check things. I could not. And believe me, I researched and I looked and I looked and I looked. There's nothing to say that currently their migration patterns are impacted by what has happened. Sharks do live a long time, but they aren't like the sharks that were alive then aren't alive now.
But is that to say that the current trends aren't a result of what happened then?
The sharks now don't do the same kind of roundabout. Because essentially what was happening was that sharks were going from...
I understand what you're saying. It's just the wording of the questions around here. Being a lot... I need to get these in writing. Anyway.
But you know what? It's our birthday month. I feel like I think that we should go ahead and give you the point.
I will take the point.
I think I'm gonna override and say that you're gonna get the point. And I really just wanted to bring this up because it was fascinating to me. And also why you should fact check things that are on IG because, you always should.
Absolutely.
So yeah, I'll give you the point.
Right,
for your birthday.
Two and one. Jasmine has 2. I have 1.
Yeah.
We got an entire year to go, so you'll look out for it. Jasmine being sneaky with these little word choices that she's using, so I guess I gotta come good next month. Well, wow. Well, I think it's just so fascinating that we learn so many things, and like to Jasmine's point, always fact check information. We have the internet at our fingertips, so it's not that hard to find out information, and I think it's always good to just learn more information so that we are more informed and can make the best decisions for ourselves. So thank you for that Jasmine. Thank you for the point. I will take it happily and sleep very well tonight.
I'm happy about that. I'm glad that I could give you a birthday present. After we're done, I'm going to watch Succession. So if anyone's listening and also watches this show, it's absolutely fascinating. I am enthralled in the nonsense of wealthy white people. Yeah.
Okay, cool. Well, that's a plug for Succession. Never heard of it until today, but hope that you are able to enjoy that. Thank you all so much for tuning in once again for another great episode. Please let us know how we did. Let us know if you enjoyed it, if there are things you think we should do differently, if there are questions you want answered, or anything in between. We'd love to hear it, love the feedback. Appreciate you all tuning in. Cheers.
Bye. We'll see you next month.
Peace.